Hello and welcome to this talk about the North East and North Cumbria Patient Safety Collaborative. I'm Tony Roberts, I'm the Patient Safety Collaborative Programme Lead. So what are Patient Safety Collaboratives? Well, they were established by NHS Improvement in 2014 and they were born out of the Professor Don Berwick's report of the safety of patients in England published in August 2014, which was called A Promise to Learn, a Commitment to Act. That document really sets out a promise, a commitment to act and to place quality and safety of patient care above all other aims for the NHS. We want to hear from patients and carers to engage and empower them across the entire system. It's aimed at fostering growth and development of our staff, particularly in their ability to improve the processes within which they work. And it really insists on a model of transparency so that the NHS is accountable, trustworthy, and really learns as it delivers care. Where are they? Well, there are 15 of them in England, supported by the academic health science networks, who are themselves grouped into a network. There's a web page you can go to which shows all the sub-regions so you can work out which AHSN covers your particular patch. We're in the North East and North Cumbria, so that section at the top of the England is where we cover. The overall aims and objectives of the Patient Safety Collaboratives are really to identify the priority areas for safety work, to develop solutions, implement them locally, test them, and where they're successful, share them nationally with the other collaboratives so that the NHS is quicker and better, more efficient at learning and sharing good practice for safety. In the North East and North Cumbria, we focused on a programme of work based around the national priorities, aligned to those priorities. We're also very interested in developing the capacity of the region to do more quality and safety work over time. And we need to make sure that all of the stakeholders are engaged and understand what's going on and can learn from what's being done. In 2015, we started with 7 programmes. They were around sepsis, acute kidney injury, the deteriorating child, which is about sepsis and severe asthma in children, and things like mortality review, which we have a history on, and you can find information about that on other parts of the HSN website. We were interested in pressure ulcers and falls, and we had an innovative project called Think Safe, which was really about engaging patients in monitoring and managing their own safety as they went through healthcare. In 2017, we started 11 new projects, and they can be grouped into the 3 priority areas nationally, which are around maternity and neonatal work, safety culture work, so that's about changing how the NHS sees and values and deals with safety issues, and the deteriorating patient work stream, which brings together the sepsis, acute kidney injury work, but as well adds to it the National Early Warning Score work, which is around physiological observations, and particularly we're interested in the electronic capture of those. So is the AHSN having an impact? Well, I think the Patient Safety Collaboratives has been successful in engaging organisations in our area, so about 100 of them are engaged. We're not a training provider, but lots of people have come to training via our programmes, and we've trained about 6,000 staff. 60 primary care organisations are engaged in the programmes. That's often thought to be an area that's difficult to access. Lots of people come to the events, about 1,600 people have come to one of the events run by the HSN in this field. It's very difficult to really work out exactly how many patients might have been benefited, but it's in the order of 250,000. We've also been pretty successful at using our funding to leverage other funding, and that's in excess of £750,000. And we've done work that's had an impact outside. So, for example, in acute kidney injury, there are national guidelines and toolkits to support primary care in implementation of safety work in that field. And we've been a pilot site for the Q initiative, which I want to say a little bit more about. The Q Initiative, it's a national programme. It was mentioned by Don Berwick's report under the guise of 5,000 patient safety fellows, but it quickly evolved into a collaboration between the Health Foundation and NHS Improvement, supported locally by the AHSNs. What is it? Well, it's really a community that's connected across the whole of the UK, so not just England in this case. It supports people who are already working on improvement or safety initiatives. It's about making it easy to share ideas, improve our skills, and make changes that benefit patients. So it's not really about doing new work. It's about adding value to the work that we're already engaged in. In the North East and North Cumbria, we started with 11 members in 2015 in the original cohort that helped co-design and set up the network in collaboration with the Health Foundation. In 2016, we added another 5 members that would help us with the regional rollout, which happened in 2017 and added about another 120 members, so that now we're a network of 136 people across the whole of the North East and North Cumbria in different settings: primary care, secondary care, community care. Patients are involved. They're all working together on patient safety or quality initiatives. Who's in our team? Well, that's me, Tony Roberts, on the right. We're led by Julia Newton, who's a consultant in Newcastle hospitals, but also a professor in Newcastle University. Andrea Cavaco is the Programme Manager for the Patient Safety Collaborative, and Helen Ridley leads on the Q Initiative. You can find much more out about us on the AHSN website. So thank you for listening. As I say, there is a website with lots of resources and other information that you can access. And if you've got any questions or queries, there's an email address there for you to use. Thank you for listening.